Hey everyone, for this week's topic of choosing two symptoms that relate to the genitourinary system, the two symptoms that I chose to compare and contrast through a Venn diagram were fever and painful pelvis, specifically as it relates to men. The three diagnoses that I chose that just pertain to fever and not necessarily painful pelvis in men is pelvic inflammatory disease, which is some sort of infection of the female reproductive organs that's only associated with women. The second diagnosis that I chose was cervicitis, inflammation of the cervix, often also caused by some sort of infection process. And the last one, which was a little bit unique for me, I hadn't really been exposed to this one before, was intrapartum fever, which is a spontaneous fever that can happen to a small percentage of women during the laboring and birthing process itself. The five diagnoses that I chose that overlapped between fever and painful pelvis in men was UTIs, which are rare in men but can occur in about 12 to 15% of men in their lifespan. UTIs can sometimes become a second diagnosis that I chose, which is pyelonephritis, infection of the kidney, which is often caused by UTI that has spread and infected the kidney itself. Again, a little bit less common in men, but can be pretty severe in men, cause pretty significant fever as a symptom and pain. Another one that I chose is prostatitis, inflammation process of the prostate, again, usually caused by some sort of infection. And then the final one that I chose, which is a little bit rare, is interstitial cystitis. And that is caused, it's a chronic condition that's also known as bladder pain syndrome and can lead to a variety of symptoms: pain, frequent urination. Fever is one of the lesser common symptoms, but it can occur in certain patients. And the one, I said final, but I actually left one out, which is STIs, sexually transmitted infections that can affect both men and women, cause painful symptoms, and also cause fever. And the final category of diagnoses that only relates to men and painful pelvis is testicular torsion, which is a situation where the spermatic cord twists and it cuts off blood supply to the testicles, and it's considered a pretty severe medical emergency, and the pain can radiate up into the pelvis, although the majority of the pain is felt in the testicular and scrotal area. The second one that I chose was hernia, which is basically intestinal organs that protrude through a weakened area of the abdominal wall. Fever is a very, very rare initial symptom associated with this. If for some reason any of the abdominal wall or surrounding tissue perforates, it could lead to an infection, which may down the road lead to fever. But the initial hernia itself is not commonly associated with fever. And the last diagnosis that I chose was irritable bowel syndrome. Again, also not very commonly associated with fever, but can be severely painful and discomfort that can radiate all around the pelvic area.